some teenagers becoming a mother at their age is normal.
In my community, a lot of teen moms, so it's almost like a popular thing. So it's not something that I can say it's an embarrassment or something, yeah.
Whether teen pregnancy has become popular or the norm, it does have devastating effects on most of these young mothers who find themselves trapped in the cycle of poverty. Some of these young women feel that an increase in the child welfare grant will make their lives a bit easier.
I would like the government to raise the child support grant because things are very expensive. The child support grant is very small for things like formulas, nappies and more.
Others, however, feel that government needs to be more interactive and engaging when it comes to this crisis.
I would really ask for them to be a bit more hands-on for the health services so that we can reduce what is going on, teenage pregnancy. That will also help.
The new Minister of Social Development has outlined her department's immediate plans. In order to properly deliver services to those who need it most, she will first have to sort out in-house issues like the many vacancies in her department, as well as fraud and corruption relating to grants.
With people who are acting in the position, we are unable to really achieve that because people chop and change, and in the process the issues got lost and the service delivery suffers. So my priority will be to make sure that rightful people are appointed in the rightful positions and do everything else that needs to be done. Make sure that the department holds its strategic position because it looks after the majority of people of our country, which we are not complaining. We in fact are prepared to make sure that we give them better services.
Government says there is more to this problem than the economic costs. In the 2022-2023 financial year, around 150,000 girls between the ages of 10 and 19 fell pregnant, meaning many of these girls were victims of rape. Various stakeholders have called on society to work together, more sex education programs, parental involvement, and harsher sentences for rapists to bring about behavioral change in communities. Abra Barbia, SABC News, Parliament.
Joining us now to speak about the types of support required by teen mothers is Cwenga Koyana, who is the co-founder of Talitha Together. And she joins us now via our video link. Cwenga, thank you so much for your time this evening here on SABC News. I mean, my immediate question to you would be, why does it seem as if we are losing the battle here when it comes to teenage pregnancy in our country?
Thank you so much for having me, firstly. I definitely would say that we're getting it wrong in as far as starting at the home with parents educating their girl child and boy child, their daughters and sons at the appropriate age when teen pregnancy can become a reality, and that parents aren't having those conversations. I think that parents' voices and family members, guardians at home should be the most amplified voice that influences a child's knowledge and choices and decisions when they step out of the home. And that parents should not depend on the education system, which in itself, in many schools in our country, is really failing us. And as far as even the educators are impregnating our girls. You know, in 2021, there was a report that over 11,000 girls were impregnated by their male teachers at school. And, you know, even recently, we're getting lots of reports of principals, of teachers impregnating girls, getting them drunk. So that is definitely an issue that we cannot depend on our education system, which is in a large sense failing us in as far as educating. So I really believe that parents should be brave at home, starting with the kids, educating them at the right age, especially when their girls get their period and it becomes a possibility. And that, you know, any communities, family at large, you know, churches, that should be brave to really have those conversations very early and on time and empower kids young. But even when we look at education system, it does have to improve in our country. We have to really provide comprehensive, age-appropriate and quality education around reproductive health system, about sex education that has to improve exponentially in our country. So definitely around the education, the age at which it happens, and even what we notice is that substance has a big role to play. The age at which our young girls and boys get to be exposed to substance, to alcohol. A lot of the cases that we've dealt with, the girls would, very much admit to us that, like, I was under the influence of alcohol, and these are girls who are under 18. So the access to alcohol and substance plays a huge role, and we have to address that as well as a country. So I definitely think in terms of education and in terms of, just not having as much access to quality education and conversations at an early age is really where we're going wrong.
And when it comes to your experience and you interacting with young women who happen to fall pregnant, what would you say are, the biggest challenges that they come across as young mothers?
So definitely these are young girls who are living in very poor conditions and circumstances, don't really have the privileges that, of like a great education, or of even like a family or community. A lot of them have like single mothers. They don't really have much food or resources. They're just very underserviced, and they don't have support in general. So in as far as, education, we want the girls to get back to school, but because they are young mothers and they have a child, they don't really have as much focus in as far as like their studies and their work. So they need extra academic support. And that's why one of our pillars is about providing that extra school lessons, about providing, tutoring. But then what also becomes an issue then, if they cannot like meet in person, it's an issue of not having data to connect to online tutoring services, or being in a place that's connected to Wi-Fi. So that's like some of the issues, and where they're underserviced in as far as access and education. But then obviously we have like the primary needs of their physical health, not having food for themselves or for their babies. Obviously we teach them in our antenatal, postnatal classes about breastfeeding, about how to take care of the child. But as they grow, they just don't have enough food or support or clothing, especially in winter, for the babies, baby blankets. So we always do, under our donations pillar, lots of drives as much as we can to get communities to, donate baby clothes and just essential resources, sanitary towels for the mothers, maternity pads, all the things that a mom and a young teenage mom would need support in, that they don't really have because they're living in poor communities. And just support in terms of their mental health, which is another pillar of ours, just because home does become quite a hostile space when they, come home with the news that they're pregnant, or the father just disappears, and now they don't have, the father of the child is no longer there. They don't have that support. So just support in terms of mentorship, and just having people see them and love them and value them, and accept them and hold their hand through this journey of being a young adolescent mother. I definitely say those are the areas.
And of course, those are the kind of, structures and empowerment that you as a Talitha Together are indeed providing and helping when it comes to teenage mothers. But beyond what you can offer and what can be done at home, what kind of support is needed for teenage mothers, of course, to get through this very difficult time in their lives?
Definitely. So I definitely say that, they need support in terms of their health. And when we're talking about their health, they need support when they go to the clinic visits, and, ensure that their physical body is fine, that, there are no neonatal diseases that have come up, that they are physically okay to like actually be a mother. So that support in terms of themselves, and obviously making sure that their babies are healthy, that they're nourished, that they, have enough food. So in terms of just health, ensuring that they have that support to the best of their ability. So any people that are in the health and medical space, anytime you come across a teenage mother or a young mom that needs that support, their health is really vital. And then also, we really appreciate communities coming together and like donating clothing and essential toiletries for both the mom and the babies. They really need those basic support in terms of resources. And even in the education system, people who have, who can donate any textbooks and stationery, any school uniform and clothing to support the girls in that sense, and make sure that they still are quite dignified when they go to school, because they obviously experience a lot of shame and a lack of support in the school space. So a lot of donations are really accepted materially and even financially, so that we can even go out ourselves and buy all the resources they need, partner with tutoring companies or anyone who's able to help us in terms of ensuring their health is met, their health needs are met, their education is also provided, and that they're supported in terms of their well-being and their mental support. Yeah.
Cwenga, thank you so much for your time this evening here on SABC News. That's Cwenga Koyana. She is the co-founder of Talitha Together. Of course, they are ensuring and providing much needed help to teenage mothers in